introduce today's conversation on what the road ahead should be to accelerate international cooperation, given the enormous challenges that Latin America and the Caribbean face due to the COVID-19 pandemic. A special welcome and thank you to Dr. Chrissa Etienne, Director of the Pan American Health Organization, who will open today's discussion, and to Senator Kamina Johnson-Smith, Minister of Foreign Affairs and Foreign Trade of Jamaica, who will speak after Dr. Etienne. As the sole member of the Atlantic Council's Board of Directors, who is of Caribbean origin, I am so pleased that Dr. Etienne and Minister Johnson-Smith, two important Caribbean leaders, are with us today for this conversation, which also marks the launch of a new Caribbean initiative within the Atlantic Council's Adrian Arsht Latin America Center. The initiative will be focused on accelerating the region's strategic importance as a key partner for the United States, and will bring increased recognition to the importance of the Caribbean amid vast hemispheric and global challenges. The establishment of this Caribbean initiative comes at a historic defining moment for the region as it battles the efforts of the global 19 pandemic. It is my vision for this Caribbean initiative to improve upon the dialogue that has always existed between the Caribbean nations and the United States, as well as other global partners. As a Caribbean national, I personally feel that sustained attention to the Caribbean is fundamental to achieving prosperity in the years ahead. We are pleased to announce that Vicky Acevero, who lives in Trinidad and Tobago, will lead the initiative as the inaugural Senior Caribbean Fellow. Jason Marzak, Adrian Arsht Latin America Center Director, will be sharing further details regarding this groundbreaking initiative following Dr. Etienne's remarks. Thank you to Adrian Arsht, Center founder and executive board member of the Atlantic Council, Fred Kemp, president and CEO of the Atlantic Council, Damon Wilson and Jason Marzak for their support in this new Caribbean initiative. I would now like to introduce Dr. Chrissa Etienne, Director of Paahu and Regional Director for the Americas of the World Health Organization. Dr. Etienne, a native of Dominica, is currently serving her second term as Paahu Director after being re-elected in 2017. She's a foremost regional health expert and has guided Paahu's multi-pronged response to the COVID-19 pandemic. Prior to her current role, Dr. Etienne served as Assistant Director General for Health Systems and Services of the World Health Organization in Geneva. Following Dr. Etienne, Jason Marzak will welcome Minister Johnson-Smith for a keynote conversation to be followed by a panel with representatives from the OECD and Brazilian government, as well as Adrian Arsht, Latin America Center Advisory Council member, Erica Ender. Please feel free to tweet about this conversation using the hashtag LAC@UNGA. Dr. Etienne, welcome. I look forward to your perspective on how the region should continue to face one of the greatest health crises of our times. Thank you.
Thank you, Melanie, and good afternoon. Let me begin by thanking the Atlantic Council for inviting me to this discussion on Latin America and the Caribbean. I am particularly honored that I am here as you launch your Caribbean initiative. We are truly in unprecedented public health and facing an economic crisis in the region. And really, we do need every opportunity to leverage success. Your mission at the Adrian Arsht Latin America Center is quite in keeping with what ours is as well. And I agree that now more than ever, we need to commit to the actions to achieve your mission, our mission, the Caribbean and the Atlantic's mission. I saw a recent quote from Adrian, and she said, and let me quote, Resilience is not about averting disasters. It is about preparing for them, navigating through them, and recovering from them in a way that builds a stronger community. We totally agree. At the Pan American Health Organization, we have a 40-year history of successful emergency preparedness and disaster relief operations, including the recent major pandemics such as H1N1 and Zika. We see annual hurricanes and storms, volcanoes, and earthquakes. But this pandemic is beyond the capability of any one sector, and indeed the health sector. Our health systems have been affected in ways that we have never seen before. The pandemic has resulted in the deaths of more than 2,500 healthcare workers in 19 countries. It is also devastating our economies. The Economic Commission for Latin America and the Caribbean forecasts that Latin America and the Caribbean will experience an estimated 9% reduction in GDP, with some 45 million people falling below the poverty line. We face a challenge without precedent, and it will require strong, well funded health systems to see us through this crisis and allow us to recover. Countries and cities need significant sustained interventions across sectors to suppress COVID 19, to protect our health gains, and to tackle the mounting poverty and inequalities. Countries' health systems are the primary responders for public health in the pandemic, but they are not alone. With regional institutions like the IDB, ECLAC, and Paahu, and the breadth of global organizations, bilateral partners, countries in the Americas have support for pandemic response and economic reactivation. So, where are we today? Globally, there have been nearly 31 million cases and more than 964,000 deaths. The Americas contributes more than half of the cases and deaths globally, amounting to over 15.7 million cases and more than 533,000 deaths. The number of cases reported per day continue to increase in many countries and territories within Latin America and the Caribbean. There are more than 84,000 cases and 1,900 deaths reported in the last 24 hours alone in the Americas. In the last 7 days, 52% of deaths globally has been in the Americas. However, we recognize that each country, each state or province, and each city or village has its own profile. So our countries are showing a downward case trends, while some others are spiking. We see the impact that the reopening of international travel is having in some countries, especially noticeable in the Caribbean. We recognize that some national trends are showing important successes. But this pandemic is essentially a series of local outbreaks with very different characteristics. As we have heard over the past months, COVID is without precedent, but there are certain realities that we must face. Strong, well funded health systems are needed to care for surge in illnesses. However, this pandemic has exposed the structural deficiencies in health and social protection in the region of the Americas. You will know the America remains one of the most inequitable regions in the world, with millions lacking access to the social determinants and environmental determinants. Countries and cities need significant and sustained interventions across sectors to suppress the pandemic virus, to protect health gains, and to tackle the mounting poverty and inequality. The health of our vulnerable groups, our citizens, and the health of our economies depend on this collaboration. The gains that we have seen in Latin America and the Caribbean have we have seen health coverage come at a significant cost to individuals and their families. Households in Latin America and the Caribbean cover more than one third of healthcare costs through direct out of pocket payments. We see 95 million people incur catastrophic health expenditure, and nearly 12 million become poorer as a result of these out-of-pocket expenditures. Again, unfortunately, beyond the immediate effects of COVID-19, it is important to note that services for essential programs have also been postponed. I'm talking about immunization, about TB and malaria treatment, about reproductive health services, maternal health, and mental health. But let's arising out of those challenges, what are some of the opportunities for leveraging success? To take control of the pandemic, we need to address many interdependent challenges. And that's why this multi-sectoral approach, and all of you representing here, that's why all of those, your efforts are important for success. The first one I want to cite is the adoption of and adherence to public health measures. This includes the promulgation of legislation and technical norms, adaptation of safe public spaces, really adhering to all of the public health measures that have been put forward hitherto. We must face these challenges together as a region, remembering that it is never too late to turn this epidemic around. We must innovate and embrace new measures. We are all convinced that collaborations can bring about change. The access to COVID-19 tools, or what we refer to as the ACT Accelerator, is evidence of the collaboration and the change. We think that the COVAX facility is an important pillar, which is an important pillar in the ACT Accelerator. This offers the best chance to all countries to ensure access to effective and efficacious vaccines. And it is grounded in the principles of the Paahu revolving fund for vaccines. I welcome and encourage the role that the Americas are playing in the development of these innovative health technologies. Many countries are actively contributing to research and to the development of vaccines and therapeutics. They are hosting clinical trials and they are generating evidence. Global partnerships and the transfer of technology will also enable our region to manufacture some of the anticipated vaccines, resulting in improved regional and global supply. So this virus is exceptionally clever in its way that it latches on its spiky surface to healthy cells. However, beyond just the mechanics of it, the mode of infection, COVID-19 has also been clever in its ability to exacerbate well-established challenges to Pan-Americanism. Well-established migration patterns of health workers within the Americas that limit countries' capacity to implement necessary surge capacity. Healthcare facilities' obligation to protect healthcare workers, which depend on PPEs, but we saw a market failure very early in the pandemic, and we continue to see limited access for countries that are low income or low middle income. We see countries with economies that are dependent upon very few sectors, and they may be under substantial stress to restart their economies without the necessary response measures in place. And one of those is those that are involved in the informal economies. It is around that group of people that is dominated by women that we are seeing some of the highest increases in COVID infection. So these examples reinforce the need for collective action and support to reinforce the Pan-American spirit so that we can succeed together. Let me thank you again for the efforts of the Adrienne Ash, this initiative, and let me thank you again for inviting us to participate. Over and thank you.
Thank you so much, Dr. Etienne, for your thoughtful and insightful remarks on behalf of Paahu and the World Health Organization. As we mark the launch of our new Caribbean initiative, as director of the EGR's Latin America Center, it's a real honor to have you with us today. I wanted to ask you one quick follow-up question. In your remarks, you know the importance of innovation, collaboration, sustained intervention for what you note as a challenge without precedent. On that note, I'd like to ask you how you're seeing cooperation between multilateral organizations. How is Paahu working with other regional institutions like the Inter-American Development Bank Economic Commission for Latin America and the Caribbean, global organizations like the World Bank and the United Nations. How are these multi-organizations working together, and what more can be done to accelerate that collaboration? You're on mute.
Thank you. All right, so let me thank you for this question regarding some of the specifics of Paahu collaboration. First of all, let me make the point that this pandemic is too consequential, it's too big, as I said, for any one health sector or any one organization, and Paahu has recognized this. So as I already mentioned, we've had a collaboration with ECLAC where we looked at the interface between social issues, between the economy and health, recognizing that unless you deal with the pandemic in the health sphere, you're never going to be able to recover your economy. We've also worked with the Inter-American Development Bank, with regional banks like the CAF, Central American Bank, and the World Bank and IMF, particularly to provide governments with access to quality biomedical equipment, to laboratory tests, diagnostics, and PPEs, and those were extremely important in the early days of the pandemic within this region. So these collaborations with the international financial institutions are led by national counterparts. So as such, our work is guided by national priorities. So it is how we bring that collaborative effort to bear with the government's effort to achieve success. I need to say that we are also engaged with a number of UN agencies. We work with NGOs, with civil society, and our work is supported by many developmental partners, including governments and the private sector. How can we improve this? I believe that when governments and all of these agencies, if we put the welfare of persons first, if we put persons and the people at the very center of development, if we begin to collaborate in an environment of non-competition, I think we could go a long way. And if we listen to governments, if we listen to the needs of countries, we can go a long way into further assisting countries and the peoples in those countries to fight COVID. Over.
Great. Well, thank you so much, Dr. Etienne. That's a fantastic way to end your comments. Again, I want to thank you for joining us. We look forward to working with you and to working with Paahu at this critical moment. I'd now like to welcome Senator the Honorable Kamina Johnson-Smith, Minister of Foreign Affairs and Foreign Trade of Jamaica, to this live conversation. Minister Johnson-Smith, it's great to have you with us today. Your presence today is important for a number of reasons. Among them, you join us on the day in which the Adrian Arts Latin America Center announces its new Caribbean initiative. Quickly, why are we launching this initiative? As Melanie noted at the top, we firmly believe, especially this time of unprecedented global challenges, that the Caribbean must be part of the solution to world problems, and that both the United States and the Caribbean will only benefit with greater dialogue and joint problem solving. With a spotlight on how regional and global trends play out in the Caribbean and why their impacts cannot be overlooked, our Caribbean initiative will address things like the importance of the implications of COVID-19 for island economies, China's increased presence in the Caribbean, security, illicit flows, energy transition, climate change, Venezuela's crisis, implications of inequality, a whole host of regional and global issues in which the Caribbean is front and center. We firmly believe this is the moment to pay more attention to the role of the Caribbean and to highlight the many benefits of deeper ties with the United States, of closer economic cooperation, and of new partnerships to jointly address global issues that reverberate across the Caribbean. With that announcement, Mr. Johnson-Smith, it's now my great pleasure to introduce you and welcome you to this live conversation. First off, Minister, congratulations on your reappointment as Minister of Foreign Affairs and Foreign Trade 2 weeks ago following Prime Minister Olmos's electoral win. Minister Johnson-Smith, who has served in her current role for the last 4.5 years, Minister, you're a true leader in Jamaica. As Minister, you have, among other things, focused on ways to strengthen governance, education, youth, gender issues, and also have put forward a number of different motions to laws related to violence against women, children, the elderly, persons with disabilities. So Thank you for all your leadership, and great to have you here. My first question to you is looking at the implications of the COVID-19 pandemic in the Caribbean. For many countries whose economies are heavily dependent on tourism as a major source of revenue, countries like Jamaica, where I understand tourist arrivals in July were only 16% of a year ago. I'd like to start by asking you, what has been the effect of COVID-19 in Jamaica, and also how is Jamaica coping and innovating to deal with this crisis?
First, let me thank you for inviting me. Thank you for creating this space, and to congratulate you and your team on the launch of your new Caribbean Center. I think that the Caribbean, being the third border of the United States, uh, increased focus, deepening of our partnership, strengthening of our dialogue and cooperation can only redound positively to all our nations. And therefore, we thank you for the project, or the initiative which you're undertaking. And again, thank you for having us and having Jamaica present today. The impact of COVID-19 on Jamaica as well as the Caribbean certainly has been dramatic from an economic perspective. And in fact, we have been quite clear to indicate that the crisis has not only been a health crisis, but a social and economic one, because certainly all sectors have been impacted. In respect of the outfall, we have had double-digit impact in respect of manufacturing, retail, distribution, etc., because of the linkages in our economy and because of the constraints which have had to be placed on movement, essentially to control the virus. We have been innovating. We have entered into public-private partnerships, for example, with a Jamaican company that has international reach called the Amber Group, that created an app that allowed us to start with controlled re-entry of our nationals who were all over the world and who needed to come home when borders were closed. That has transitioned and transformed into a new app that has allowed for controlled entry of tourists and other travelers, business travelers, coming to Jamaica in a way which is safe and controlled. And that has, of course, built additional confidence in the destination. We established also an external support coordination committee chaired by myself, which managed to align available support with needs. You know, sometimes when there is a crisis, there can be misalignment in that proportionality that can end up with things either not being useful or not being used. We've ensured that we have maximized our international cooperation by ensuring that there was a committee, interministerial committee, which had all the agencies of the UN represented here, other multilaterals, IFIs, as well as all departments of our Ministry of Health together. And we would meet on a weekly basis to ensure that what was taking place was beneficial and directly contributing to the building of our health capacity and reducing the impact on our social sectors as well. So we've been doing quite a bit right across the board. I could go on quite a bit on this though, so you'll have to stop me, Jason.
That's fantastic, and I frankly look forward to using that app myself when I can go back and visit Jamaica.
Yes.
The quick follow-up question: how likely do you think we are to in Jamaica to start to see a return to, I'll use the word normalcy, getting Jamaica to where it was pre-COVID, and how are you thinking about that and planning for that?
Right. Well, one thing that was very good is that we had just been through a spate of strong macroeconomic reform, so that we were, in fact, in a stronger position than we would ever have been before to be resilient and to recover stronger. So we're very positive and optimistic about our actions. Jamaica, I think, was the first country in the Caribbean to be allocated the Safe Travel stamp of the World Travel and Tourism Council, as well as the WTO, because what we did was we established a tourism resilient corridor, geographic area, where persons have been trained in specific health protocols, sanitization protocols. Transportation is different from the airport, and we have strong screening and sanitization protocols from the point of entry, meaning from your, as a matter of fact, before you enter, you would have applied through the app, which would have done our initial screening. Then you have a strong set of protocols straight through the airport to your hotel, which gives a strong sense of comfort and safety for everyone who comes to Jamaica. We have had a spike because of outside of the corridor. We have had additional activities in the local community which have impacted our numbers, and we're seeking to bring that back under control now. We have never locked down as a country. We have established protocols in respect of community quarantines and ensured that there's a strong quarantine protocol as well for persons visiting outside of the travel resilient corridor. This we think we are confident that this will ensure that we rebound stronger. And as we are about to enter the cusp of our winter season, we are working with airlines, with our private sector. Our hotels are all at the ready. We took the downtime to train our personnel in the service sector online, and they're therefore more ready than ever to welcome you to Jamaica.
That's fantastic. Really, really great lessons. I think probably even to share with other countries as well. Quick last question for you. Today, as we discussed, we're launching the new Caribbean-ish as part of the Agent Orange Latin America Center. I'd like to ask you, what do you see insofar as how can the United States work together with Jamaica and also the region more broadly to address some of the trends that we'll be looking at as part of our work, visit flows, China's role, COVID's impacts. How do you see the United States being an even better partner for Jamaica and other countries in the Caribbean moving forward?
Well, the U.S. continues to be our strongest security partner for starts. So certainly in respect of policing our waters, which assists all of us with controlling guns for drugs, which is a great facilitator of illicit flows of funds, and in supporting us from a technical capacity, all countries in compliance with FATF and other international protocols which require our financial systems to be robust. Jamaica has always been strong on compliance, and we continue to share best practices where we have them and to be open to learning new practices. We in fact have an action plan which will take us out of our current status and move us into into an improved platform level. The U.S., as I indicated before, we have always considered ourselves the third border, and the U.S. is not only our largest trading partner and our strongest security partner, but they are our largest source of tourism and certainly one of our greatest travel destinations for nationals and home to one of our largest diasporic populations. So the number of synergies and partnerships, the number of levels at which our partnerships exist can only allow us to strengthen and deepen as we move along, recognizing that the challenges in this world today can only be dealt with through partnership, through dialogue, through increased technical capacity, and through investment to ensure that our economies are able to provide for persons to have better standards of living that ensure that we optimize and live out our best lives right here in the Caribbean.
That's fantastic. What a great final comment, and we look forward to Minister having you at the Atlantic Council in Washington when the time permits, or frankly, I'd rather actually come to Jamaica and have a conversation with you there. But thank you again, the Honorable Minister Kamina Johnson-Smith, for joining us today. Thank you for your leadership, and look forward to working with you, country Jamaica, as we continue to move forward with our new Caribbean initiative as part of the Agent Orange Latin America Center.
Thank you for having me, and I wish you and the center all the best, and we look forward to welcoming all of you to visit Jamaica.
Thank you very much. I'd like to now turn the program over to
visitjamaica.com.
I'm sorry?
Visitjamaica.com.
Visitjamaica.com. Okay. Thank you very much. Thank you very much. I'd like to now turn the program over to Roberta Braga, Deputy Director of Programs and Outreach, to guide the next segment of the conversation.
Thank you so much, Jason. Thank you, Minister. And thank you so much, Dr. Etienne, as well. I am thrilled to be here to moderate today's panel discussion with a great group of 4 experts from the region, 2 Brazilians like myself. So it's I'm very happy to be here. I know we only have 30 minutes left, so I'd like to jump right in introducing our speakers today. Masamichi Kono, Deputy Secretary General at the OECD, to share his perspectives a bit more broadly on the region. Yana Dumaresque, Assistant Deputy Minister, Foreign Trade and International Affairs at Brazil's Ministry of the Economy. Carlos Pinto, Country Manager for International Finance Corporation Brazil, and Erica Ender, philanthropist, singer, and songwriter, and a member of our own advisory board of the Adrian Arsh Latin America Center. Thank you to all four of you for joining us today, this afternoon. Welcome.
Thank you, Roberta. I gotta say that you have 2.5 Brazilians because I'm half Brazilian.
That's also true. I'm always happy when this is the case. I wanted to start today's conversation with you, Deputy Secretary General Kono, by asking you to give us a little bit of context, your perspective on what you assess the economic impact of the pandemic being more broadly, and also in Latin America and the Caribbean. We all know that the pandemic is fundamentally changing how global supply chains function. Companies are starting to move production to the region for reasons of efficiency, profitability, safety. And so, how does the OECD assess those broader economic impacts? And then, how can governments and firms be making global supply chains more resilient, not just in the short term right now, but also looking into the future post-pandemic?
Thank you, Roberta, for the kind introduction and a long list of issues. That's a great question, actually. But first, I should mention that despite the fact that I come originally from Japan, for the OECD, actually, the Latin America and the Caribbean is an extremely important region. We have several member countries. We have prospective member countries, and we have a regional program with the region. So it's really a great opportunity for us to, of course, also showcase some OECD work. But anyway, I will try to be brief in, in doing some publicity. But on the other hand, just to say, I mean, a lot has already been mentioned, but this is the worst economic contraction since the Second World War for the entire world. It's not just Latin America and the Caribbean, of course, but and actually in our latest economic projections, all G20 countries, with the exception of China, maybe will have suffered a steep contraction of their economies in 2020. China with some modest growth, but not really a great one. And next year, even the recovery will be fragile. I mean, it is expected to be fragile. And in Latin American countries, of course, that will also be the case. And we will end up being below the levels of 2019, even at the end of 2021 in many countries. So this is really a dire situation. But then, of course, I did hear, I didn't miss hearing actually from Minister Johnson Smith that actually there is some optimism, there is some opportunities. But at least we have to cope with this unprecedented situation. And just to take trade, I mean, we see trade dropping by close to 20% year on year. This is world trade in merchandise. And so we have to remember that in this particular situation, international policy coordination and international cooperation really matters. And we somehow have to regain certainty and confidence in the system. And actually, regional cooperation is one of the really the important key to enabling a recovery, which we all want. Now, one recognition that I would like to really mention, based on OECD analysis, actually, is that despite the fact that we did have a lot of stress in the supply chains, despite the fact that there were some disruptions, actually, global supply chains have proven essential in providing the goods necessary to tackle the pandemic. And we see that global supply chains are part of the solution. to manage risks and shocks, and to enable actually an inclusive recovery, which again we all want. And even if when there were disruptions, actually a lot of those events were disruptions in domestic value chains or in the last mile delivery. And I have some examples like road transport in Europe or meat processing in the US. Um, I mean, those were basically disruptions at in the last mile of delivery, let's say. And I also have this example of face masks. I mean, um, of course, we all experienced an unprecedented surge in demand for face masks, but actually the global production and trade of masks increased tenfold during this period. So um, the basic recognition that we must have, or realization that we must have, is that no country can produce all the goods it needs to combat COVID-19, and that therefore we do need trade. Do need foreign direct investment, and there are lots of things that we can do to actually facilitate those that are essential for recovery. And by the way, as recently as yesterday, we're encouraged by the G20 trade ministers actually mentioning in their statement that trade and investment must act as important engines of growth and productivity, innovation, job creation, and so on. And it also says that global supply chains, I mean, we need to increase the sustainability and resilience of national, regional, and global supply chains. That is what the minister said. So, shall I stop here? We do have some ideas for further strengthening resilience in trade, but
Thank you so much,
over to you.
Secretary General. I'm really glad that you brought up that the cooperation, collaboration, which has been an ongoing theme throughout today's conversation, but also throughout the last year, really. And the issue of modernizing and creating more resilient global supply chains. That's something that we at the Adrian Arch Latin America Center are certainly looking at, prioritizing, and we'll continue to sort of look through that. Also, ahead of US elections and into next year, what might that mean for cooperation in the Western Hemisphere, but also with other regions of the world? Erica, I'd like to turn to you. We know that the destabilizing effects of this pandemic haven't only been economic in nature, that for the region, we've seen the pandemic affecting progress in areas of social responsibility. The human toll has been insurmountable. And so as a philanthropist yourself, someone whose foundation does a lot of work on education and to reduce inequalities, I wanted to pose the question to you of what you believe that the role of foundations like your own Open Doors Foundation can be, and the role of the international community. What do you think that can be for helping the region rebuild from the current situation?
Well, in my case, our foundation has something that makes it a little different from, I think, any other, because we use entertainment, arts to do good, to educate, to find ways of making projects that could really help the common good. And as I've told you before, we have this big project called Talento, which means talento con propósito, talent with a purpose, that has been out there for several years and has helped us through the arts make the youth, I don't know if you can say that in English, like agents of change, activists. We show them how to find their capabilities, their skills, and at the same time, we showcase their talent by helping them understand that everything that they do has to be made towards the common good. And then that helps us to restore every year 12 schools, in extreme poverty. In Panama, we have 19.1% of extreme poverty. And it's a country that has a canal and that has that it's a paraíso fiscal. I don't know how to say that in tax paradise. No, like we have a lot of banks in Panama and everything. So we have so many advantages, and we shouldn't have over 700,000 people suffering extreme poverty. And now with the COVID-19, of course, it affected our foundation because our project had to do with schools and with a bunch of people moving from one place to another in order to restore the schools that we restore, and the theaters that have these events of the youth of the competition itself. But then what we did was that we change a little bit of our minds to see how we can use the platform that we already had in order to affect positively the people that were suffering. Our government was helping with nutritional baskets, the people that was quarantined and that was in extreme poverty. And then we noticed that those baskets had a lack of food for children from 0 to 5, which is very important as well. So we stepped in, and then we created the Talent Challenge, which was uniting all the winners of previous generations in order to compete on TV, since we all need content right now, and to raise the money in order to create baskets for kids. So we could help a lot of kids, thousands of kids and families right now. Doing that, we saw a tsunami wave coming, and we said we have to surf it, because there's no way that we're going to stand here if we're trying to plant that seed of action in each one of our people, of our youth. And besides that, right now we have a new program after helping these families for over more than 2,000 families in each one of the regions in Panama. Besides that, what we're doing is not only giving them the fish, but also helping them after this 3-month period that has been very, very hard for everyone that has lost their jobs and everything, besides the poverty that there already is in Panama. Encouraging them and giving them the tools to have home gardens so that they can make their own food. And while this passes, and they can all go back to their jobs, or they can find a job, or they can find a way of living again after this quarantine, to make sure that at least they can eat, which is the most important thing for a human being. If you don't breathe, if you don't drink water, if you don't eat, you don't have dreams to achieve. So that's what we're doing right now, and using all the platform that we have and helping as much people as we can.
Well, that's amazing work. And we're talking so much about resilience of the economy, but the resilience of the next generation is really where we need to be going as well. And I think that we'll all have to come out of this crisis a little bit stronger and more adaptable and innovative. And your foundation certainly doing that. So thank you so much. Yana, I'd like to pivot to you, taking the focus a little bit toward globalization, multilateralism, and cooperation, as we had been talking about. In many ways, this pandemic has really prompted the entire world to rethink those concepts. How do you see international institutions assisting countries in Latin America, assisting Brazil in your case, to recover from the impact of COVID-19? Brazil's been one of the countries that has suffered the most from this pandemic. So what would you say are the priorities there?
So the pandemic found the world in a more disaggregated way, right? Multilateralism was not in its best shape when the pandemic hit us all. But we all know that coordination is the name of the game. There won't be full recovery without international community coordination. From vaccine production to supply chain flows and rebounds in investments, it's all interconnected. So we'll need to find our way in channeling perhaps all that energy that was around intentions or in the issues that we were not agreeing upon, and we will need to channel it to a common ground that is solutions oriented and that will guide us through the so-called build back better. In the case of Brazil, we counted big time on the international community. In the main two fronts, that we had to face in the COVID-19 crisis, both in the response side and also in the recovery side. So I would like to mention just a couple of big examples on that. The first one, we brought together the World Bank, the Inter-American Development Bank, CAF, the New Development Bank, and some bilateral agencies, the French, German, Japanese, around a big project to strengthen our social safety nets and support the most vulnerable ones in Brazil. So self-employed, informal sector, the poorest families, they were assisted through a network of international organizations and government organizations that could be present to them in this very difficult time. So much more than money, those organizations also brought to the table their expertise, their sense of urgency, their strengths, all through the emergency responses that each institution developed in this crisis. And after this successful experience, we also put together a second joint and big project, this time with the IDB and with the New Development Bank, to assist small and medium enterprises in fighting the pandemic, keeping their operations running, protecting their workers, and finding resilience over the times and supporting the period, the critical period of the pandemic. But let me bring a final example, my final one, that illustrates the timely opportunity for joining efforts with the international community. So the COVID-19 outbreak has a very sad facet that is also very present in the climate crisis, that is called the double exposure phenomenon. So those communities that are more severely affected, that have less conditions to fight the pandemic, are also those that will have less conditions to recover in a fast pace, right? So the water and sanitation issue is extremely true in that particular situation, because we all know water is key to fight the pandemic, the whole wash your hand campaign. And I mean, the best economic evidence also shows that proper water treatment is extremely correlated with longer term development. And Brazil has now half of the population without proper water treatment. So with that in mind, government and Congress have recently approved the Brazil's new water supply and sanitation bill, breaking down a public monopoly that has been here for ages and spurring a pipeline of projects and investments worth between 500 billion reais. But this full potential of investments can only be reached through the support of the international community in its full format, from foreign investors to multilateral development banks to multilateral frameworks that can provide predictability, stability. So we see that the international community is the ground that will make the full recovery flourish. So we have some great examples around that, and this is where our expectations are laid.
Thank you, Yana. You mentioned Brazil's cooperation with multiple international institutions, the IDB, the New Development Bank. I'd like to pivot to Carlos. Carlos, we've talked a lot about cooperation within the international community, but we also know that a strong engaged private sector is also incredibly important for boosting shared prosperity, especially right now, and to building out that resiliency and to adapting to these challenges. The IFC has leveraged billions of dollars to deliver more than, I think, 285, if I'm not mistaken, $1 billion in financing for businesses in developing countries in 7 regions of the world. And so I wanted to ask you, What are some priorities for the IFC in reducing poverty, promoting shared prosperity? And what should be the role of an organization like the IFC itself in helping to avoid further economic catastrophe, really, for the region?
Thank you, Roberta. Thank you all on behalf of IFC. Thank you for this invitation. It's a great pleasure to be here with you. As other panelists have already said, I mean, the COVID is eating really bad, affecting the poor and the more vulnerable around the world. As much as 100 million people could be pushing to extreme poverty this year. So it's a huge number. We have an ongoing global job crisis and affecting all kind of jobs, destroying jobs and affecting informal workers, a very important part of people here in South America and in Brazil too. So it's very important to preserve the private sector. Why? Because it's the private sector that will help to save jobs. So that's precisely how IFC position itself. As you know, IFC is the World Bank arm to finance the private sector, to support private sector and private sector investments. So we have stepped out to provide an adequate and speedy response, and basically three axes. The first one in March, latest March, IFC launched what we call the Fast Track COVID-19 Financing Facility. This is a $8 billion financing facility precisely designed to respond to liquidity needs from companies, private companies. So we are supporting our clients across the world, providing them the so much necessary liquidity to face the reduction in their business. The second axe is as of September 15th. So we have already deployed $2 billion in trade finance. And this is very important, as you can imagine, because it's an engine very important to support exports and imports into countries. And this is the moment where you must need to support imports for COVID supplies, this kind of medical equipment, and so on and so on. And the third one, very important, and again, I'm coming back to preserving jobs. We have to support micro and small and medium enterprises because these are the ones that create and are more relevant when it comes creating and defending jobs. So what we are doing is precisely to use international banks, local banks, providing them liquidity so that they can use this liquidity to finance micro and small and medium enterprises, because these are the ones that have more difficulty to access to finance and to credit in this current moment. If you ask me looking forward, I would say that we have a mantra, and the mantra is to rebuild better the countries. And rebuild better means build in a sustainable way and providing a resilient recovery. So everything that we will do looking forward will be subject to this criteria, to this mantra. A very important initiative recently launched by IFC is what we call the Global Health Platform. This is a $4 billion platform that will help developing countries to access to COVID supplies. So for giving you an example, if for whatever reason we don't finance developed countries like Germany or UK or Spain, but in this case, we are ready to do so as long as these countries will produce products that can be exported and used by emerging countries. So this is a very exceptional situation, but this is going to be very, very relevant. Then we are looking to the medium long term. So we have decided to innovate, and that's what we call the upstream. So from now on, we will invest a lot in participating at the initial stage of every single project. So we are not anymore waiting for the projects to be there to bring financing or advisory. We want to be part of this creation process. So we want to help uh, creating new opportunities for private investment to invest. And to conclude, I know that I'm aware of the time, sorry. We are, and Brazil, and we have Guyana with us, it's a very important country for us. And given the fiscal budgetary restrictions, not only in Brazil, but across the world, there will be severe limitations to invest the public money. So we have to attract and to bring private investment into this. So developing public-private partnerships and privatizations is very relevant. So we are keen to help in this process. We have been doing that in Brazil and across LAC and across the world. And just to give a short example, recently we have concluded with the state of São Paulo an advisory, a very important advisory work, helping state of São Paulo to structure and arranging for PPPs roads. This will attract something like $6 billion of private investment into Brazil. So that gives you an idea and a picture how important it is. Thank you so much.
Thank you, Carlos. I know I had at least 2 more questions to ask the panel, but I also want to give our audience an opportunity to ask questions. We do have one from Vicky Acevero, our new Senior Caribbean Fellow. She's asking for the OECD and the IFC, what are the new metrics you're putting in place to measure resilience and emerging innovative livelihoods during and after COVID-19? And then once you do answer that question, I will pass the floor to Erica Ender, our advisory council member, singer and songwriter, who will share a song with us that she mentioned earlier today. But Carlos, I'll pass the floor to you on the question of the metrics.
Yeah. Yes, we are in the process of defining that, but there are very straightforward KPIs that we can use. Just to tell you, I will focus again on Brazil because Jana just mentioned this recently approved water and sanitation new law in Brazil is very important. As you know, it's important to support Brazil in improving the supply of water, potable water, and sanitation. And we are looking forward to being a relevant partner in that process. So we will use these metrics, very easy and very straightforward metrics, to understand how many households in the near future every year will have access to potable water and proper sanitation. So a very easy way to measure. Thank you.
Thank you, Carlos. I know we are out of time, so I will save the comments from Deputy Secretary General Kono to share with all of you in our post-event summary that we'll circulate and also share on our website with additional resources for today. Erica's song will end today's event, so I just wanted to take a moment again to thank Dr. Etienne, to thank Minister Kamina Johnson-Smith, and to thank our wonderful panel for their comments today. I am very happy that we're launching today's Caribbean Initiative in this conversation. It's been a great moment to kind of get together around UNGA this week. So thank you again to all of you. And Erica, I will go to you. Thank you.
Okay, I know we're short, we're out of time, so I'm just going to sing a bit. But I think that this pandemic has come to teach us many lessons. And at the end, what really matters is us as human beings, nature, and everything that, makes us one home. I always say that we all live in different bedrooms, Brazil, US, Panama, whatever, but we have to take care of the common areas and of our hearts as well, on top of all. So I would like to share a little bit of the song called Everyone Matters. Imagine us flying away, so high that our eyes can discover the view you can see from the sky is a world without borders. We search for the meaning of life by reading books cover to cover. The answer lies here in your heart when you do good to others. The truth is everyone matters. Beyond the differences between us, we're one. You see, everyone matters. We need each other like the moon needs the sun. When you see everyone matters, no one's bigger or better. From below and from above, all that matters is love. 'Cause we're the same after all. Sorry for that, it's brand new and I don't remember the lyrics.
It was beautiful. Thank you so much, Erica, and thank you for everyone who joined us today. Have a wonderful rest of your afternoon.
You too. Big hug.
Having us.